Hello and welcome. You are welcome to a series that is Learn Radiology with Dr. Anil Joshi. Today's topic is over MRI physics, and that is also an important component of a supercon magnet, that is helium. Helium has got extremely important role to play in superconductivity because of its multiple characteristics, which we are going to see in this lecture. So let's get going to the topic, that is the helium, its role in MRI machine. But not before we disclose, acknowledge and disclaim. There are certain illustrations in this which we have borrowed from the net, but however we are confirmed that they are royalty free. Most of the material used in this lecture has come from many years in our department, which we use for the teaching purposes, and same is used here. However, still we acknowledge with thanks from those we have got this material. With this brief, let's going to what is helium, what is its role in MRI, and what are the precautions we need to take when we are handling helium, how it is transported, how it is filled, and what can happen by a phenomenon called quenching, that is loss of helium from tube head. Now there is different lecture covering about tube head in this series. Do visit it. In that we have given what is the importance of it in the helium cycle. Now let's get going to the topic. An MRI machine combines magnetic and electromagnetic fields for accurate and detailed visualization of different organs and tissues in the body. It is a non-invasive way of getting high resolution and multi-angle imagery for diagnostic purposes. Physicians often recommend MRI scan to assess the damages after a heart attack, to determine the source of seizures, or to locate the presence of a tumor. So also there are multiple indications which we are covered in some other lecture. Do visit our website or our YouTube channel for all these things. Now, how does helium work in MRI machine? The latest MRI, that is magnetic resonance imaging scanners, enables a clearer, more accurate image of the internal organs and soft tissues, ligaments, and capture many of the metabolites also in addition to the tissues. Why it is possible? It is because of the superconductivity, and superconductivity is achieved because of the helium, which cools them, because its boiling point is -269. And almost many of the things which were not seen on CT, now we are regularly seeing it on MRI. It is important in the medical field. It is one of a essential and also emergency and also life-saving equipment, and more than 40 million MRI scans are done because of same many indications and also its usefulness in United States each year. In addition, the industry has projected 6% job growth for MRI technicians and radiologists from 2021 to 2031. That's why it is important for radiologists, for the radiology technicians, and also those who are thinking of doing their career in MRI. It's a very promising. But how exactly do MRI scanner work, and what is the role of helium? That we are going to see today in this lecture. This first superconducting scanner in 1980s had two cryogenic chambers, and inner one containing helium, that was in liquid helium, and the outer one containing liquid nitrogen. So they had two chambers. We are talking of the earlier MRI scanners, which are not in clinical practice anywhere. The nitrogen has to be topped every week and the helium every month. So you can imagine the cost of running it. In 1990s, the helium we have developed a system which was only using helium. And as early as 2000, refrigeration system had made it so simple, made it so possible that we need to replace helium only 2 to 3 after 2 to 3 years. Why? It is because of the different techniques of refrigeration. It is because of the good designing of the cold head, and it is because of the helium circulating assembly. By improving it, we have achieved that the helium, which was in earlier machine, need to be replaced every week. Now for 2 to 3 years in present machines, we don't have to change the helium. However, still now what we are thinking is whether we can develop a machine with zero boiling point, that is a machine which will not require filling of helium over the years. This is achieved nowadays. Now how it is achieved? Over the last decade, zero boil off refrigeration system has been standardized, allowing essentially unlimited normal operation without need for a heating refill. So it retains the refill and it do not lose the barium. There is no loss of barium, loss of helium. However, the cold head and refrigeration compressor still need regular filter changes and are serving so many cryogen replacement at this time is unavoidable. So what is happening is we'll have to change, we have to give the servicing, we have to check the parts. So also we need to change certain component of the machine which will increase the efficiency, or because of that the helium will be lost more. So this achievement in the technology as well as designing has made us possible to think that there can be machine with zero loss of helium. Now what is the function of helium compressor in MRI? A helium compressor, as its name implies, is a device that compresses the helium gas. In MRI system, the compressor plays a critical role in cooling the mechanism. Now what is happening is to keep the superconductivity of the magnets, they need to be cooled, which is achieved by liquid helium. Now liquid helium has got boiling point of -269. So when it cools the magnet, it gets evaporated to a gaseous form. Now this gaseous form needs to be again put into liquid form. So we have got compressors. So the MRI machine use superconducting magnets to generate a powerful magnetic field required for the imaging, and for that you will have to have a good compressor which can put back this gas helium into a liquid form. Here you can see a cold head, which is a main component of the gantry or the magnet. The cold head is essential for circulating the helium, and what it receives is the gaseous helium, because it has to give a liquid helium which is a cold one, and it has to put it back to the compressor so that it can be again compressed, it can be cooled, and it can be sent back to the magnets so that it will do its job of cooling the magnet. Now these are helium pump and cold heads which you are seeing here. Though both are essential, both work together to see that the helium is put into liquid form after the absorption of heat from the superconductor magnets and put it back by making it liquid at a temperature -269. The most recent development in a commercially available MR magnet design is a seal unit. Now what it does, it do not allow helium losses, and therefore it will not say no filling or venting, but we can say less filling. Nowadays it has come to almost 4 to 5 years, but subsequently we may move to more than that. So that is the lifespan of any MRI machines. Now what is cryogens and refrigeration? Do superconducting scanner consume liquid helium? The answer is no. The superconducting magnet do not consume helium. Now, how often does it need to replacement? If the replacement is because the helium is consumed by the supercon magnet, or it is because of the losses from the other components. Now most modern scanners use highly efficient, that is Gifold McMahon refrigeration system. This is all dealing with a cooling of helium and to keep it in a liquid form and to avoid it as far as possible helium loss and come near zero boil off. So that is the aim which we are trying to allow, and what we are using for this are the refrigeration system by Gifford and McMahon. Please be aware that zero boil off indicates a magnet that does not consume helium during the course of a normal operation. So whatever it receives, it gives back, and during the circulation, transmission, there are no helium losses. There is however a possibility that a part failure elsewhere in the cooling system, that is cold head. Now please go to my lecture of cold head. In that way clearly mention what is the maintenance, what it does, and what will happen if there is no maintenance, because this is the main component in the cycle where there can be big losses of helium, and these are preventable. This can be detected early. You can also expect that next generation of superconducting M.R.I. scanners will not have any cryogens at all. So we are going towards a new generation, that is the latest technique in the refrigeration. This is largely due to development of the efficient pulse tube and two-stage Gifford-McMahon GM cryo coolers that are able to maintain the temperature below 9.4 K required for superconductivity without liquid helium. Currently, the 0.5 T superconducting paramade open M.R.I. is cryogen free using a GM, that is a cooling system or refrigerant system developed by, here we have seen it, we will go to earlier slide, you can see it here again, a zero boiling point, how it is achieved by a new technology which we have seen just now. So let's get going to the ahead of it. So new GM systems are available, they are using different techniques, they have got good superconductivity, and they can maintain temperature below 39 K. So these are the ideal situation for any magnet to work. Cold head and refrigeration system are used in Gifford-McMahon technology. Gifford-McMahon technology is also called popularly a GM system, and that we are seeing in earlier slide also and here also, that what it is and how it works. The cold head, which condenses helium into the liquid, is inserted into a top of M.R.I. magnet cryostat. Liquid helium is the perfect element, cold enough to provide the level of superconductivity required in the machine scanner. It cools down the superconducting magnet, which generate images of the human body that is below the temperature of 4.15 Kelvin, that is minus 269 degrees, that is the boiling point of helium. So it cools the magnet till that temperature. The helium free system have three important differences from the traditional M.I. system. Now what are the differences? A very low amount of helium are used, number one. The helium system is completely sealed, so there is no boil off of helium over the time. No vent or quench stack is required for these sealed low helium systems. So they are actually ideal, but what we have got today are the magnet only up to 0.5 Tesla. The main medical use of liquid helium is for magnetic resonance imaging system. We are using helium, but is it the only place where used? The answer is no. There are a lot of other uses of helium also. The liquid helium is needed as a refrigerant for the superconducting magnet that are critical component in many of the devices. During an M.R.I. scan, the patient lies on the movable table which steadily enters into a large tube like magnet. This is in a nutshell we are saying what is the process of M.R.I. procedure, where patient lies on a table, then patient goes into the magnet, and then the radio waves are stimulated, the atoms are imaged, whatever changes are happening in them are imaged, and that is useful for medical diagnostic purposes. Some tests can be shorter while there can be much longer tests also. This is grossly just to tell you how helium is used in a machine, how it takes the MRI scan of a patient. All detailed different videos are available. Helium serves various purposes across a wide range of industries, not only medical. The medical field is one of them. In fact, helium is commonly used in MRI machines and scanners. It's true. A liquid helium has notably low boiling point, that is minus 269, and which can be also called as minus 452 Fahrenheit. So it is a perfect capable of cooling down MRI machines. That's why it is used in refrigeration system of MRI. It is effective in bringing down the electrical resistance of the magnets virtually at negative level or at no level. So there is no electrical losses in that. But how exact does liquid helium do that? MRI machine, each time a magnet and a wires conduct electric current, they thus have a magnetic field. So because there is the electricity applied, there is a magnetic field and superconductivity when the wires inside the MRI machines hits really low temperature. So they become superconductive when they reach a lower temperature, which is minus 269. Considering the extremely low boiling point of the helium, it is most capable of getting the job done, which we need to put the wires into the superconducting stage by taking them to minus 269 degrees. Keeping in mind just how frequently MRI machines are used and how vital they are in diagnosis and monitoring of the health condition, it comes to that medical field is one of the most important consumer, or the helium is most maximum required in a medical industry. For an MRI machine to keep it going, you require around 1700 liters of liquid helium. Now here we are seeing a helium gas source, then it is going to MRI machine, then it is converted, a liquid is converted into the gas form, then it goes to the lever with liquid helium, and then there is a compressor which puts it back to the temperature of minus 269. So that is how the system works. Now here what we are seeing is the MRI scanner is filled with approximately 1000 liters of liquid helium. We are showing you the levers, that is the container by which helium is transported, how it is connected, and how it is put into the magnet. Now when we say 1000 liter liquid is put, that means it is half the capacity, because total requirement is 1.7 to 2000 liters of helium, liquid helium. Advantage, it is not flammable and is generally safe to use in many of the situations. Helium is an inert gas with non-reactive, it is not reacting with anything, it do not have any poisonous combinations, allowing for some unique uses for balloons and beams to other industries with dangerous material and high heat. This can still be used because it is non-flammable and it is safe. However, we do know that balloons and beams can explode. That is not because of the helium, but because of the external sources around it. Now helium has to be handled safely. As I told you, it is safe, it is inert, it doesn't cause any side effects. However, the safety precaution has to be taken. Now here of course the cylinders MRI machine designs is such that nobody can go there except their service engineer. So it is always away from the patients as well as from the playing children's. There is always necessity to wear eye protection when inflating a balloon, but that we are not going to see because that is not a topic of our lecture. However, we are seeing the toxicity effect, and when we see that, we have to see its application in all the fields. So where it is filled in a balloon, they will have to wear a goggle. And never open a cylinder valve without fitting an inflator. Otherwise what will happen? The helium gas will come out and it will have some disadvantages or some side effects. What are they? Unless they do not occur unless you expose directly to it, and that do not happen with MRI machines. So no need to worry about the MRI workers. There will not be any problem for them. There are adequate measures taken that there will not be quenching. However, when we talk of the helium, we have to talk of its all applications, including outside the medical field. That can cause headache, dizziness and lightheadedness. Then there may be suffocation from lack of oxygen in some workers, those who are dealing with the industrial helium. Then contact with liquid helium can cause frostbite because the temperature is -269. But please note, these are not in medical field. It is where elsewhere the helium is used. It comes as a topic when we talk of the helium. Now, with that, we are coming to end of the lecture. I thank you for giving your valuable time. Please visit our website for comprehensive detailed lectures on this topic. There are many more terminologies which we have talked about in this lecture. If you want to know details of them, do visit our YouTube channel or website. Thank you, goodbye and take care. See you in next lecture again.